MD Talk. Weight loss wonder. Treatment discussion. Welcome back to MD Talk Runner Stories for the Road. In today's episode, we are diving into an intriguing topic, a diabetes drug that's shown to be effective in its role in weight loss treatment. Whether you're a runner looking to optimize your health or just interested in the latest medical advancements, this discussion is one you won't want to miss. In a study that came out in November 2021 in the New England Journal of Medicine, researchers looked into the problem of gaining weight back after losing it. This is a common problem for people who are overweight. The goal of the study was to find out how well different ways keep good weight loss going, especially after an 8-week low-calorie diet. The weight gain dilemma. Obesity is getting worse and is a major health risk. Weight loss is a good goal, but people often gain the weight back after they lose it, which can be upsetting. This study looked into the issue and attempted to find a solution. Study design. The study was done in a very scientific way by using a random, placebo-controlled setup. At first, people with BMIs between 32 and 43 and no diabetes were put on an 8-week low-calorie diet. After this phase, they were given one of 4 treatment plans at random: exercise alone, liraglutide medication alone, a mix of exercise and liraglutide, or a placebo group that kept doing what they were doing before. Results. People lost an incredible 13.1 kg in the first 8 weeks of the diet. But after a year, the most important results became clear. This method not only helped people lose the most weight, but it also led to big drops in their body fat percentage. Liraglutide is a drug that is used to treat diabetes type 2 and its associated obesity. It is a glucagon-like peptide-1, GLP-1 receptor agonist, which is a type of drug. Liraglutide works as a synthetic version of glucagon-like peptide-1, GLP-1, a hormone that the body makes on its own. Liraglutide lasts longer due to a minor structural difference which allows it to bind to albumin. For example, endogenous GLP-1 has a very short half-life of 2 minutes compared to liraglutide, which is 13 hours. Here is a brief explanation of how it works. GLP-1 agonist. Liraglutide works like a synthetic version of GLP-1, which is a hormone that is made in the intestines when food is digested. GLP-1 is a very important part of controlling how much sugar is in the blood. Controlling blood sugar. When you eat, your blood sugar levels rise, leading to activation of GLP-1, which can stimulate the alpha-beta receptors on pancreas to produce more insulin through messenger intracellular cyclical adenosine monophosphate (CAMP) mechanism. Insulin is needed to move glucose, sugar, from the bloodstream into cells where it can be used as energy. Liraglutide can also affect how much you want to eat. It works on the parts of the brain that control hunger to make you feel less hungry and more full, which makes you eat less. Slowing digestion. Liraglutide slows the rate at which the stomach empties, which can help you feel full and have more control over how much food you eat. In terms of weight loss, liraglutide's ability to control blood sugar, lower appetite, and slow digestion makes it a useful tool for helping people keep their weight under control. It is usually given as part of a complete plan to lose weight, which also includes eating less and exercising. Advantage. The combination approach is very appealing because it has a lot of other health benefits that make it even better. Specifically, it led to gains in glycated hemoglobin levels, insulin sensitivity, and cardiorespiratory fitness. These results show that this method has benefits that go beyond just losing weight. Adverse effects. Even though liraglutide showed potential, it did have some negative side effects like a faster heart rate and gallstones. The group that only took liraglutide had more of these side effects than the combination group. This shows how important it is to think about both the pros and cons of any treatment. This study gives people hope in a world that is struggling with an obesity crisis. It seems to show that combining exercise with liraglutide therapy is a strong way to keep healthy weight loss going over time. This two-pronged method not only helps people lose more weight, but it also has a lot of health benefits like making people more fit and helping them control their blood sugar better. This study is definitely a step in the right direction, but it's important to remember that it might not work for everyone. People may react differently, so it's important to think about things like age, the amount of obesity at the start, and other health problems. In conclusion, this study shows how important it is to have weight management plans that are both comprehensive and tailored to each person. It shows that keeping a healthy weight isn't just about the number on the scale. It's also about a person's overall health and lowering the risk of health problems caused by fat. It's a good step forward in the fight against the obesity problem and a ray of hope for people who are trying to keep off the weight they've worked so hard to lose.